Hello everyone. So today's goal is to try to bring physical therapy home. I know not everyone can make it to as many sessions that get prescribed, or they don't know how to translate it after being in the physical therapy office to be able to get it done at home because they may not have the equipment. So I am bringing you into my house so I can show you how to do it with the equipment and some of the movements without the equipment so that you don't have to go out and buy stuff just to get your exercise in and recover. I do feel the need to say that this is not meant in any way to take over from going to physical therapy. It's just there to help you get it done at home as well. For this first exercise, we're simply taking the ball, trying to activate some of the leg muscles by extending out the foot and pulling it back in. At this stage, I'm able to do it voluntarily with my leg alone. In the earlier stages, you may require a strap or a belt to something to help pull your leg back. Do not go past 90 degrees. That is the point that we are trying to reach and nothing further. That is why you see the hand placed up in the air and down low. If you don't have a ball, simply do leg slide outs, which you'll see here in a moment. If you get something like a pop, which I tend to do, dig your heel in a little bit, forcing a little more muscle activation, and it tends to help stop that pop. Next, we have stuff for core stabilization. You can see at the physical therapy office, I use the ball, but I know not everyone's going to have an exercise ball. So what you can do is put your hands across your chest and kind of hold a crunch. Just make sure you're holding into your abdomen. Squeeze it hard or push into your legs like you would the ball at physical therapy. If you need to take a break, feel free to lay down, take a quick rest, and then get right back at it. I do these about 3 times for 1 minute. This next one requires 2 motions, and because of the tightness of the belt, it can be hard to see. What you're going to do is at 10 seconds, you squeeze in the ball, and when you're done with those 10 seconds, you're going to pull out on the belt. This forces different muscles to work over the time frame that you do it. I tend to have to do this for 3 minutes straight. If you need a break, you let your legs down. I've had my foot try to cramp on me before. So I'm showing you how to do it with an exercise band in case you don't have a belt. If you don't have an exercise band or a ball, you can actually go in and just squeeze your feet together, pull them apart. But you've got to be very careful about the range of motion, which is a part of where these exercise bands and belts can come in handy because you're activating the muscles without actually overextending them. I want to point out that you see me doing stuff on my own, like putting that ball in and out, and you'll see me doing other stuff later. It's definitely helpful to have a partner if you have one to get some of this done, especially in the earlier stages. It can be a little tough to maneuver the body and keep it where it's supposed to be. So if you have a partner that's willing to help, let them see how it's supposed to be done and get them to put that ball where it needs to go. This next exercise is essentially the same thing as when you have the ball in between your feet, just in your knees. And now you're going to squeeze together and then let it out after 10 seconds. The ones with the belts are probably my least favorite just because you feel like you're getting nowhere no matter how much you struggle. So as much as I know they help, they get very frustrating because no matter your strength, you're not pulling that belt apart. So I wanted to show you with the ball and with the pillow. You can always remove the pillow and just kind of squeeze the knees together. You can hold the pillow with your hands. Just be careful with that range again. With the ball, you can use a belt or you can use the exercise band like I did on the foot. The belt I have is just off a pair of pants that I bought some years ago that came with one of those cheap sliding belts. Moving on, we've got Superbands. If you can't hold a Superman, you can always start by just using your lower body so that you can at least get some muscle activation. You're going to try to hold this and engage that back like he just showed where he was sliding his hands down at. Then we're going to work on some cross-core stabilization by trying to hold and pull from opposite sides. This allows for cross-body exercises and stabilization. You can see that I'm doing it all on a bed. If you have another space, we even have a countertop space that we never use, that if I just felt like laying on there for some reason, I could use myself. So that fancy belt is just there to help with the quad. You can't see it in physical therapy too well, but I've actually got something under my leg. So I don't have a half piece like that. I just take a pillow and I stretch it out. If you don't have the belt, you can just use it with your hand, or you can make a loop in a belt and pull it forward. Next, we have press-ups. The whole point of this is just to kind of engage that back a little bit more, give the spine a little bit of a stretch, and a little bit of relief on those muscles. So I don't have any of this at the house, but I wanted to show from just a couple of angles how you go, and that's just a tolerance. You don't need to go too far or try to form an arch when you do this. Next, we have single leg raises that are going back up and then off to the side at an angle, which unfortunately I didn't realize when I was recording that I wasn't really capturing that too well for y'all. I stuck with the bed. I would recommend something a little bit higher just so you're not as leaned, but if this is all you have to work with, it'll work just fine. Next, we're doing calf extensions. I used the foam roller just because I didn't feel like putting a pillow on the floor. If you have something just to elevate your feet so you can go past even, get those calves a nice stretch, that would help work wonderful. This is also an exercise where, if needed, you can lean all the way back to a laying down position. Finally, we have something to help engage those quad muscles. My left one, they said they could already see atrophy in, so we're just trying to get them reactivated and hold that off. We're not trying to strengthen, we're just trying to keep them going. You can do it single or double. Thank you for taking the time to watch, everyone. I hope this video will help you be able to perform some activities at home to help assist with your recovery, or maybe just simply give you some exercises to kind of work that hip even after recovery. If you're liking the content so far, please be sure to subscribe, and I hope to bring you fresh content every week.